얼마 있는데?
400이요. 일단 이거 받으시고 나머지는 제가 다음 달까지 꼭.
Oi! Okay, so getting punched in the nose. Sometimes you bleed right away. If you start to bleed like that, if you're able to, pinch your nose and lean forward. If you lean back, you're gonna get the blood to drip down the back of your throat, cause you to be nauseous, and might actually vomit and make things worse.
봐봐. 아이고.
Oh, don't do that. Eating, licking somebody else's blood, don't recommend that.
You can't do that.
It's being ingested. You can spread infection. You worry about hepatitis B and C as well as HIV. It's no good. Oh no.
너 코피가 왜 잘 나는지 알아? 코 안에 모세혈관이 많아서 그래.
Oh, don't do that. So yes, there are blood vessels here in the nose, on the septum, on either side. There's something called Kesselbeck's plexus, which is basically a lot of vessels there that can bleed quite easily.
맛도 좋던데. 한 사발 받아다가 오늘 밤 선짓국이나 끓여 먹어야겠다.
Some people's nasal tissue are a lot more frail to have the capillaries break open and bleed a lot. We also get bad bleeding in the posterior aspect of the nose, which actually could be life-threatening if a vessel ruptures open. Very dangerous.
아, 맘 약해지게 왜 울부짖어하랴. 아, 내가 산적 많은 거 어떻게 알아가지고. 자, 눈물 닦고 여기 지장 찍어.
He's asking for his fingerprint. We all have our own unique fingerprints. Here in the United States, when you're born in a hospital, typically you get footprints and handprints. As a medical professional, I've had to do fingerprinting myself for me to prescribe certain medications. Oi.
개쇼하지 말고 일어나.
Oh, blood coming from the mouth. Could be the airway or the mouth at that point. Why are you vomiting blood? If say you're shot in the stomach or you're shot in the intestine and you're leaking blood into those organs. Oh, he's moving. So shot on the left back through and through. If it's going directly through the lung, it can cause a hemothorax, a pneumothorax, or typically a combination of a hemopneumothorax. She's got somebody else's blood on the face. Potentially hit the eyes, mucous membrane. If there's any bloodborne pathogen in that blood, it could be transmitted via the eyes. Oh, she's gonna move and she's gonna get shot. Yep. We see a lot of gunshot wounds at hospitals here in the United States. Typically, you actually end up going to a trauma center. Sometimes you'll end up at a normal emergency department because you might not be able to make it. Oh, no. So this game, so to speak, is about like steady hands, taking your time. Most surgeons out there are super steady.
Steady hand.
An easy way to prevent your hand from shaking is actually just to anchor your hand. So using either the side of your arm, the hand, a pinky.
한 번만 제발 한 번만 더.
Holy cow! They did a pretty good job relating to what things would look like. I'm not a blood splatter expert, but you definitely get skull fragments, brain matter, and blood that will all come flying out. If it hits a certain part of the brain, you're going to be alive for a short period of time if it's not directly hitting the areas of the brain relating to respirations and breathing. But once the swelling kicks in, then it's going to go through different effects relating to brain herniation, which will affect those areas. Remember these metal slides? I've seen so many videos of people getting injured. Blood actually is quite sticky.
Is it sticky?
So it could actually cause a lot of issues.
의사양반 손이 오늘따라 더 느려.
Whoa, I forgot about these scenes.
배달 시간 놓쳐서 배 떠나면 다 헛수고다.
I've been in many operating rooms when I was in training. As a non-surgical resident, we did kind of more minimal things like suture the skin wounds closed, or we would help like retract to keep things open.
Retract.
내일 잠도 제대로 못 자고 먹을 것도
Wait,
제대로 못
trying to
먹고.
do this on no sleep and only crappy food. I feel like that's every resident out there who's on a surgical rotation. There's a lot more rules nowadays that regulate how many hours that you can work in a row and how many hours in a week. I remember when I was a resident many years ago, we got capped at 80 hours a week.
죽을 고비 넘겨가면서 이 짓 한번 해봐.
So it's like a X-lap. So they're doing like a exploratory laparotomy maybe. Everything is open in the abdomen. Oh, they're harvesting organs. Awful. I've actually never been in a procedure relating to harvesting organs, but it's an amazing gift.
It is a gift.
That somebody is able to donate their organs to somebody else who will actually be able to survive. The individual getting the organ has to do a really good job of taking care of themselves. This setting, obviously, it's clean procedure. It doesn't seem to be as sterile. They're just trying to protect themselves from getting bloody. In a sterile situation, you're having sterile gowns, sterile gloves, you're wearing a mask, you're wearing eye shields. Holy cow. You don't just flap the skin open in these massive holes. You use the smallest incision possible to do certain procedures. You actually have different types of tools to actually retract the body cavity open to minimize how much you're opening the body.
요령만 좀 알려주면 나도 할 수 있을 것 같은데?
내가 여기서 이러고 있다고 이게 쉬워 보여?
요즘 뉴스 보면 간호조무사니 사무장들이 대신 수술도 하더만.
In the US, no. The individuals that are performing surgery, board certified surgeon and any subspecialty that surgeon is, sometimes medical students under the supervision and consent, but typically not office managers.
오히려 의사보다도 낫다던데.
There must be a recently deceased individual, a lot of blood still. They're trying to mimic how the tissue would be. It's a little bit more flappy, so to speak, but if you have a thick amount of subcutaneous tissue underneath there, it could move in that particular way.
그렇게 자신 있으면 네가 직접 하던가.
Very interesting, very intense. I just remember I did not like standing there for, 4, 5, 6, 7 hours doing the same thing. Especially, you're sweating underneath all the sterile gowns and all that stuff. I'd rather be out, moving around, seeing multiple patients. Oh, you gotta get in, okay. Oh!
He really did lose his marbles.
He is sweating profusely and got the shakes. Basically, your fight or flight response. Your heart rate's gonna be up, your blood pressure's gonna be up, your eyes are going to be really dilated. But part of the issue is you're actually gonna be a little shaky. Oh, that's gonna be a bad ending. Gunshot wounds to the chest, multiple. The assessment starts in the pre-hospital setting, and your first things are airway, breathing, circulation, as well as bleeding control. A lot of things happening all at once. It's just ways so your brain can remember, okay, these are the things that I need to stay on top of and not get off track.
고마워. 나랑 같이 해줘서.
A GSW to the lateral aspect of the skull, you're gonna have fracture on both sides of the skull, and you're gonna have the big hole on the entrance and big fragmented skull pieces on the opposite side where it's going out. Oh, I hate this. So you're going through both hemispheres. The middle is all super important stuff, basic life functions. This is unlikely to come to the emergency department. It's unlikely that this is sustainable with life. You're gonna see brain matter on scene. You're gonna see kind of white, gray matter, but it's mostly gonna be coated with the red stuff. Oh, we gotta take off the shoes. Actually, being barefoot in itself, you actually have more feeling, able to use different components of your feet for stabilization, so it's actually not a bad idea. But you could start getting very sweaty and slippery. Choose wisely. Oh. Oh, just glass in general. I've had to take pieces of glass out of people's feet before. Man, it is difficult because glass is super hard to see, especially when it's in tissue, when it's coated in the red stuff. What we'll end up doing first is typically getting an x-ray to see where the glass piece is. Oh. Wow. That looks like, I don't even know,
You tell me what to do. I don't know what's going on.
10 stories. Fall from that height, the likelihood of survival is pretty low. The likelihood is you're going to succumb to the injuries. Significant trauma relating to compression of your skull, traumatic force to your chest causing injury to the heart, lots of fractures and potentially bleeding out. Ooh. Oh. Well, yeah. Again, glass injuries, super sharp and clean wounds. So they'll actually heal really well. You just have to approximate the tissue. Look at all that. Wow. Suturing a laceration is pretty easy, and anesthetizing it is actually pretty easy as well. We'll use an anesthetic, inject it into the tissue, but we don't make new holes on the skin on the outside. We will actually inject into the wound already, so you're not actually causing more trauma to the outer tissue. Oh, big, sharp piece of glass into the abdomen. You think about it as just penetrating trauma with a blade. What do I always say? Don't pull it out, because it's potentially tamponading or blocking whatever it just went through, meaning your aorta that runs through your abdomen. It's going to be a hose that is open and just pouring out. Oh, don't do it! Don't do it! That's left lower quadrant. What organs or what do we worry about? You have your descending colon, you have the ureter, which is basically the tube from the kidney down to the bladder. You have a lot of muscles. And then from a female organ standpoint, you have an ovary on that side. Hold that pressure. There wasn't that significant amount of blood that initially came out, which could be a good thing. Or you could just be bleeding out on the inside of your abdomen. The way that she is using the clothes to strap around it, that is fine, but it's actually not that much pressure. So I would recommend holding that area with whatever she had for a good 10 minutes, 15 minutes, even 20 minutes, and holding pressure to that area. Then bulky dressing to any cavity that's there. Don't shove too far in, and then wrap with pressure around it. Whew. I would not want to be these contestants, no way. Just makes my heart race watching it. If you're feeling like you need some calm vibes in your life, you should definitely check out Chillax by my company, Life Happens. It can help aid in relaxation against all of life's occasional stresses. Definitely check it out at lifehappens.com or on Amazon.
기억나? 여기 지나면 뭐라고 했는지?
쓸데없는 소리 하지 말고.
Getting sand in the eye, it's the worst. The cornea is super sensitive, so that's the area of our eye that is clear, that covers the colored part of the eye, and it's got a lot of nerves in there, so that can cause significant pain if there's a cut or laceration due to a foreign body in the eye. Ooh. Slice the hand, slice the face, superficial lacerations just causing pain. Ooh. Strangulation issues. Here, they're trying to use fabric to cause airway collapse or decrease blood flow to the brain. Not hard to do, but your upper airway is made up of cartilage, the trachea. There's only one tracheal ring.
One ring to rule them all.
That goes all the way around. The rest actually go partially around. Ooh. Oh! Biting the soft tissue, causing pain to that area. There's gonna be bacteria. The mouth of a human being is super dirty, so there'll be infection if you live long enough. Oh! Blade in the hands. Could you pull it out? Yes.
Yes.
Very specifically if it's between the bones. Typically if it's in the bone, it's really hard to pull out. Oh, you couldn't do it.
형. 미안해.
Oh! That was deep. An attempt to get the carotid artery. You're gonna hit the jugular vein because typically the jugular vein is like here and the carotid artery sits underneath smaller. The vein is protecting an artery. Typically the veins are more superficial or to the surface. Oh, nice hair. I did this once when I was in college. My freshman year of college, I dyed my hair the same color. Oh, it's got a tracker. The skin behind the ear here. There's not much tissue underneath. You have the skin, and that bone back there is actually your mastoid. Sometimes that can actually get infected, the bone, if you have really bad ear infection, and then you can get something called mastoiditis, which is actually quite dangerous. Oh, geez. Oh, come on. Come on. Oh, that's gotta hurt. Brand new razor blades are actually really sharp. We actually use tools in the emergency departments or in the hospital that are similar, like an 11 blade, but it's not sterile, right? So just be aware of that. Oh, I'm assuming this is quite painful. If I were to do this, you need to anesthetize the area, inject some lidocaine to it, numb it up so you can make it a lot easier. Other ways you can do, maybe you can use some ice to numb the area, but the numbing is gonna go away pretty fast.
여러분들이 하실 게임은 가위, 바위보,
Paper, rock, scissors, -1.
아시죠?
Oh.
두 손으로 가위바위보를 하고 하나만 빼서 남은 걸로 승부를 겨루는 게임.
We see a lot of trauma to the face, bleeding, bruising, different colors, and that does happen depending on the timing. Bruising starts out as more like red, then turns to like blue, purple, and then actually over time will turn to like a greenish yellow and then disappear. It just has to do with the breakdown products of the red blood cells.
이 권총에 총알 하나를 넣고 닫습니다. 그리고 지는 분 머리에다가 방아쇠를 당길 거.
Gunshot wound to the right side of the head, going straight across. You have the two hemispheres. If you hit it perfectly down the middle, there is a chance that you're not gonna have as much damage, minus the fractured bone particles from the front and the back. He sacrificed for his buddy. Oh, you're definitely hitting tissue on both sides, and then a lot of your major structures are actually deep within the middle section of our brains. We don't see that many gunshot wounds that come into the emergency department where it's directly to the side like that. Usually they're very angulated. If you're close up like that, you're gonna have gun residue, you're gonna have burns to the scalp. It's not gonna be as clean as it's depicted here in the show. But yes, the likelihood of survival is pretty minimal unless it was a blank.
지금부터 제가 하는 말 잘 들으세요. 이거 그냥 게임이 아닙니다. 게임을 하다
Oh no, remember in the first season, this is where you play red light, green light, 1, 2, 3. Oh.
뭐야?
Oh no! Anybody out there allergic to bees? Let me know in the comments. But I wonder if somebody were to be bitten and it went into like anaphylaxis or something, if they had medical care to help them during the game. I don't know. Do not move. Oh no.
다 움직였어.
Oh! Took a shot and direct hit to the head. That other guy got blood all over his face, definitely into his eyes, even into the mouth. Increased their risk of getting transferred of any bloodborne pathogens. The bloodborne pathogens that I'm talking about is like HIV, hepatitis B, hepatitis C. Those are the big ones. Oh, took a GSW to the upper part of the chest on the left side. Could hit the heart, could hit the aorta, which is like this big, massive blood vessel coming off our heart that literally supplies all the blood to the rest of our bodies. If you get a big hole through that, you're gonna bleed out really fast.
그거 하면 안 돼요, 저도.
장로가 정리될 때까지 잠시 기다려 주시기 바랍니다.
너 이게 뭔지 알아?
엑스터시.
Oh, that guy is using some illegal substances. Ecstasy is MDMA. It's a stimulant and a minor psychedelic, so people use it at like raves. Ketamine is a dissociative hypnotic, and we actually use that medication at the hospital for sedation.
이거 새로 합성한 거라 완전 crazy man. 너 감당 안 돼.
I wouldn't pop any of those suspicious pills, but if I was needing a little more chill in my life, I'd reach out for Chillax by my company, Life Happens. It's an occasional stress support supplement. If you want to learn more about Chillax, check it out at lifehappens.com or on Amazon. Okay. Oh, 10. Go. Go, 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 go. It almost feels like sometimes in the emergency department, a little bit of chaos happens often enough that people are able to control their emotions and get the job done.
와, 우리 어머니
Oh. Get out. It looks like it's a different number, maybe number 2. That position can collapse the trachea, decreasing oxygen. You can collapse most of the airway down because the cartilage of the trachea is kind of flexible and it doesn't go all the way around, except for one, your cricoid cartilage. You also have to think about the blood flow in and out of the brain. Oh. I don't see these type of injuries that come in. Somebody who has a high cervical injury where the autonomic nervous system is not active, so you're not breathing anymore and your heart stops. Does it happen that fast? Hard to exactly know, but probably pretty quickly. Oh! I can say I've never been punched in the face before. I've taken a soccer ball to the face, but getting punched in the face hurts. You're hitting your bone, but also hurts somebody else's hand. And we get very common fractures of people's hands called the boxer fracture. Oh, the bleeding in the mouth is the worst. Most likely 2 different reasons. Your mucosa on the inside hits your teeth and causes a laceration, or your teeth start getting loose and you start bleeding from the gums. Oh, you're trying to choke out. So it looks like most of the pressure is on the trachea. And actually you can see the lips are starting to turn blue here. Actually, really good depiction of it.
He's turning blue.
You're probably going to lose your airway soon, or you can actually cause a break of the cartilage. It bends a lot, but you can cause a break there. Or if it's high enough, there's a hyoid bone. You can fracture that as well. What happened? That was like a gooey, squishy noise. Oh man, a submental puncture wound with a fork underneath your mandible here. A lot of soft tissue here going straight up into the floor of the mouth. It's going to cause some bleeding and pain, but it's not mortal. It's not going to make you lose a lot of blood.
Should have gone for the head.
Oh, come on.
Come on!
So it looks like the first guy gets shot in the right side of the chest. That is going straight through your lung. Is it going to be immediately deadly? No. Is it going to suck? Yes. Could go through your ribs and break them. Could come out the other side, break those ribs, or break the scapula that's sitting on the other side.
제발 살려주세요. 제 딸이 많이 아픕니다.
Ooh. Interesting. It looks like 246 gets shot right by his numbers. That could hit the left side of his lung or into the heart. It depends where he is on his respirations when he actually takes a shot. If you're in a big inhale, the heart will drop more centrally because the diaphragm drops down.
게임장 안에 숨은 파란 팀을 30분 내에 찾아내서 죽이면 통과입니다.
Oh man, stabs him on the left flank back area, like kidney shot. Could be lower part of the lung into the diaphragm, or could hit into the spleen on that side, or hit into the kidney, or just soft tissue hitting into the bowel. So there's a lot of different things that can happen. Ow. The outer aspect of the right thigh. There's mostly muscle, that side part of your leg, really tender. When it takes the blade out, you do see a bunch of blood squirt out, which could happen. It could also just be like the pooled amount of blood that's coming out. It's dark. Dark blood typically means it's venous, which is what you'd expect. Could also stab into the bone. You always have a risk of causing a fracture or puncture into the bone, increasing the risk of infection. Elbows to the side of the face increase the risk of fractures to the jaw itself here. We see that commonly where the hinge point, you can get fractures. Can cause discomfort to the ear. It's highly innervated, so you're having pain to that cartilage. Oh, nice. We hear a crunching noise, so the question ends up being, is dislocation, ligamentous injury, or was there a fracture? Oh. I'm assuming because the player succumbs to the injury quickly, that this probably went through the left lung and then angled into the heart itself, or hit into the aorta, or all of the above. Does it happen this fast? Probably not, but it could happen pretty quickly. It just all depends on the structures that are hit. We see bleeding to the left shoulder. Most likely it's either a laceration or a puncture wound. Holding it in that position and still having function of the arm in this flex position at the elbow. Likelihood that this is more soft tissue, maybe deltoid involved. This movement has to do with your bicep. If it was deeper or cut the bicep, you wouldn't likely be able to do that position. Ooh. Oh man, a human bite to the wrist. Ouch. If you break skin with a human bite, it's very dirty. Bacterial thriving area of our bodies, and you do increase the risk of getting an infection because these are puncture wounds, so you can embed the bacteria into the tissue. Oh, stab wound into the back. The back has your strap muscles and all these big different muscles that protect us, protect the spine, and are thick and deep. It takes a lot to get through that tissue, and it's a far distance to get into hitting any major organs in our body. Lateral aspect of your neck, carotid artery, jugular vein, and this is most likely going into the airway or the esophagus. Stabbing into that area, rupturing those major blood vessels, bleeding out, and affecting the airway. Getting a blade even that deep can actually even puncture into the lungs. You'd be surprised how high the lungs come up. Wow. He's getting blood splatter from another person into his face. Increase the risk of transmission of any bloodborne pathogen, especially if it gets in his eye. That is most likely where the transmission would occur unless there was open cuts to his own face and the blood got in. Pathogens that you think about are hepatitis B and C, as well as HIV. Oh, jeez. Jump rope. If I was trapped in a deadly version of a jump rope, I'd be stressed too. For real world anxious feelings, I reach for Chillax, my doctor formulated occasional stress support supplement. No side games, just calm vibes. Get your own Chillax today at lifehappens.com or on Amazon. Oh, you're getting hit by that metal bar on the lateral aspect of your ankle, which is where your fibula is, which is a very thin bone. So the likelihood is that you're going to break your ankle right there, causing pain. That's a fall from a great height that is likely not possible to recover from. That is why I talk about falls from great heights, because anytime there's something greater than 3 times your own height is actually really high when it comes to trauma relating to our bodies. Oh my gosh. Oh, enucleated the eyeball. Awful. Going straight through the main part of the eye, the iris and your pupil. That area is covered with your cornea. Highly specialized cells, but cells that are very sensitive. If you even push on it, it's going to cause a lot of pain, and then you're going to enucleate the eye. Now, is there some blood? Yes, but it's actually going to be mostly fluid. Could a human have the force to be able to puncture through somebody's eye? Yes.
Yes.
We worry about any lacerations where the fluid is coming out of the eye itself. It needs to be sutured closed and potentially having fluid put back in. There are synthetics that you can use now. Oh, stab wound to the chest cavity going medially. That is going to be on the individual's left side, probably going into the heart, versus if it's just going directly here through the chest, it's going to cause a pneumothorax and bleeding, as well as a hemothorax. Oh. Oi, the noises. This individual passes out, basically. We don't know if they pass away yet, but they pass out and lose bodily function basically within 10 to 15 seconds, which is pretty darn fast. Usually it'll probably be from somebody passing out and then they succumb to the injury shortly after that. Oh no, of course.
Of course.
In emergency medicine and in trauma medicine, anytime you fall from greater than 3 times your own height, you always want to consider worst case scenarios. It doesn't mean that you're ultimately going to have really bad outcomes. It just means that the index of suspicion needs to be high. One small piece. Oh. Shards of glass can also get embedded in the hand or the tissue. We'll get an x-ray of somebody to see if there's actually any pieces of glass still in somebody's tissue. If there is, we got to go find it and try to get it out of there. Sometimes we can't, and you'd actually have to have a continuous x-ray done, trying to navigate the tissue to get it out of there. Whew. What? This movie is disastrous. At least we got some anatomy where we're seeing things we normally wouldn't see. In real life, there's a lot of the red stuff around and it coats things so you can't see it. When we have somebody who comes into the emergency department with bad traumas and a lot of bleeding, you can't see things really well, so we have to get the bleeding to stop. Oh gosh, the crunch noise, probably a distal tib-fib fracture. People break this often. It's near the ankle, makes up part of the ankle joint itself. There's multiple bones that make up the ankle joint. Oh gosh. Impaled through the posterior part of their skull or the high up part of the neck going through. The amount of blood coming through could potentially happen. This is basically through somebody's brain stem in the back. The brain stem has to do with your autonomic nervous system and your function, so it's not compatible with life. Got all the other person's blood in their face, in their mouth, in their eyes, definitely transmitting whatever potential pathogen is in the blood into that individual. You're thinking hepatitis B, hepatitis C, HIV. Those are the big viral ones that you worry about. Oh, glass right into someone's foot. Oh gosh. We get x-rays, we'll see the glass. We want to make sure that there's no broken bone. If it's going through your shoes, you got to cover for different types of bacteria. Depends on if it's a foam shoe versus a normal sneaker versus barefoot. You need different types of medication. And then puncture wounds, you need to close up or have it slightly open to allow drainage.
Drainage! It's okay. Sorry.
Lawnmower blade to somebody's face. A lot of soft tissue injury. How would somebody pass away from this injury? It would have to go deep enough to cause the destruction of the brain tissue and interfere with the airway itself. Oh my gosh. Just rip it out. Just rip it out. You're screwed. Just rip it out. Oh, now you're on fire. When somebody does come to the ER with burns, we want to make sure heart rate and blood pressure are all normal. We also want to make sure that their airway is intact. If there's concern that the airway might get occluded soon because of swelling or melting of the airway, we'll do an early intubation to make sure that we're protecting them. Oh. Yep. Nope. I mean, what? How much body surface area did you get burned? What areas of the body did you get burned? And lack of oxygen, smoke inhalation, altered mental status from the chemicals that are being burned, or you burned your airway so badly that it's melted away and you can't get any oxygen in.
No one gives a shit about your stupid little death curse, okay? So take a hint and leave us alone.
Oh gosh.
We're not coming for our family.
Oh my gosh. Oh, it's a compactor. Oh my gosh. That is so scary. What? What? Oh my gosh. Slow compressive force crushing the jaw, skull, and the rest of the body. Most of the time, jaw fractures we end up seeing from somebody getting punched in the face. Fracture might happen over here, and then you see another one on the other side or in the middle because the energy has to come out. They did a good job of like skull fractures open. You're gonna have bleeding because of the tissue ripping open.
That's really good. You gotta be kidding me when you're telling me you're not allergic anymore?
I don't know, man. The hair grew out of it.
When somebody has an allergic reaction, the first thing we always think about is the hives that we're getting. What also will happen is you'll have swelling of tissue where it feel like your throat is closing because you're having swelling of the tissue of the tongue, and then your blood vessels are vasodilating, so your blood is going out to the periphery, your blood pressure is dropping.
Hey, you're doing it. Yeah, you're doing it. Bobby, you're doing it. I can't give you that. Okay?
Emergent treatment is epinephrine, adrenaline, that EpiPen. You just slam it into your tissue somewhere, get it in your body. Sometimes you have to have multiple doses of it. It's really good to make sure that you have a 2-pack of your EpiPen with refills.
Bobby, hey.
Wait, what? Watching these treacherous injuries reminds me that sometimes life's occasional stresses can hit just as fast. That's where Chillax by my company Life Happens could help ease the tension and bring on those calm vibes. Check it out at lifehappens.com or Amazon. What the heck? Oh! Oof. Oh my gosh. Come on. I think this is called the Prince Albert. I think. Bend backwards like that. Is there enough force to be able to do that? I don't know.
I don't know.
Wow. He's got a lot of facial swelling. We do see that people's faces will swell, but he got the epinephrine in there, so hopefully it starts kicking in pretty fast. It usually works pretty fast. You'll start feeling tachycardic, a little jittery, but that is normal. Keep moving, keep moving. These things weigh a lot. If they hit somebody, they're going to crush you. These cases don't come to the emergency department because they're DOA, basically. They're pronounced on scene. I believe in an earlier Final Destination, there was an issue with big trees on the highway.
Who wants to be the first to tell me what the hell just happened? Who's what?
Oh, man. Could definitely do this to somebody because of the speed and the weight of the wrench. Blood, kind of appropriate in what you're seeing pooling. It's very dark. You wouldn't see it as bright because there's probably more venous blood than arterial blood coming out. Right behind your eyes, your frontal lobe, but then going further back, you're going more underneath that frontal lobe right into your midbrain. All of a sudden the person is out cold, unconscious. This person could just be massively like brain dead versus did it hit that area and cause you to succumb to the injury. Oh. Okay. This is like one of those classic lifts to help somebody get in and out of the pool. We actually use these at the hospital as well. We call them Hoyer lifts, but they're basically lifts to be able to help move individuals so that way the people moving them don't hurt themselves and it's comfortable for the patient as well. Whoa, okay, so somebody intubated, so that's a breathing tube into the airway on a ventilator. Actually quite appropriate. You got an IV line going behind, and that is a classic tube holder that somebody would have in place. Sometimes if you don't have a tube holder, you can actually use a piece of tape and twist it around the tube as well. Oh, come on, getting electrocuted. Come on! Hospitals use so much energy because everything requires electricity. Hospitals actually have really good backup generators as well. Oh, it's a lot of water. Nobody's noticing this massive amount of water. Come on. Come on! Pools up on high floors. I mean, shouldn't they be down like on ground level or below ground? Oh, so he was able to extubate himself. At the end of that breathing tube, you have a balloon cuff that keeps it in place in the trachea. You pull that out, you can actually rip your vocal cords, really injure them. What? Come on. Come on. That amount of water, gallons and gallons of water, the amount of weight that is going to crush the individual as well as potentially drown them. Maybe the initial impact is going to cause a significant amount of trauma to this individual, which then could lead to the demise. Wow, cool. We get some x-rays. Run over by the car. All the ribs, the spine falling into pieces. Comminuted, displaced. What that means is all the structures that the ribs are protecting are going to get destroyed as well. Oh, getting driven by the truck into the wall, causing rotatory injury to the cervical spine. You see all those jagged lines on the skull? We all have them because our bone was actually fused. It's interesting that they give us a little bit of the red stuff, even though it's an x-ray. You wouldn't see that normally. All the teeth come flying out. The teeth are actually pieces. That means the roots stayed in and the teeth all just fractured. If this happens to you, go find that tooth, see if it's something that we can potentially put back in. But if it's broken like that, the likelihood is no. Oh, wow. I mean, sometimes you feel like you need to get a good massage, but not that aggressive.
Ooh, are those things even sterilized? No, I'm not catching any diseases unless I've earned them.
We won't talk about that. But this is acupuncture, a traditional Chinese medical technique to basically help bring about balance and healing energy to the body using very, very fine needles. I've actually even had it done to try to help relieve muscle spasms. Oh no.
Oh. Hey, fire!
When somebody gets a burn to the skin, 1st degree, 2nd degree, 3rd degree, and even 4th degree. Holy cow. 1st degree, it's like a sunburn. 2nd degree burn will cause blistering, will pop, and then your skin will heal. 3rd degree burn, everything is charred, won't heal on its own, needs to be replaced with skin grafts. 4th degree burn, it's all the way down into the muscles and the bones, and really not a good scenario. Come on. They even show like the top piece of a vertebrae just like hanging out there. We got different types of material, softer brain material, you got skin, you got skull. Typically, if this were to happen in real life, you wouldn't get that much splatter. Oh, I love the intensity of the propane grill.
Propane.
Okay, all normal behavior. Oh my gosh, so you heated up the mug. Now you're gonna put something super cold, increase the risk of cracking the mug. Duh.
Knew it.
If you're like me and feeling a little riled up after watching these clips, you should definitely check out Chillax by my company Life Happens, an occasional stress support supplement to help you find those calm vibes and unwind. Find Chillax on our website at lifehappens.com or on Amazon. Oh, come on. Come on. Remember, don't pull it out, but this is the classic reaction that people get. Depending on where the injury is, if it's a vascular problem, you literally now have a faucet of an open, bleeding vessel. Where this stab wound is actually probably a little low relating to the heart. That's like the lower part of the sternum, right at the xiphoid, maybe the epigastric area where the stomach is. You might want to go potentially a little bit higher into the left. That way we know, okay, it's definitely the heart. Oh, what was that? What would you do if you saw that? I don't know if I would even handle it like what the heck just happened? Is this survivable? Probably unlikely. The potential is this individual might still have a pulse. They may succumb to the injury pretty darn fast, but you don't know. So you do need to check. Oh, what the heck? The amount of brain tissue that's gone, this would likely not come to the emergency department, but I have seen patients that come in with exposed brain matter. We still resuscitate to a point, but a lot of times once we see that and they're not alive, we stop.
Back to it.
Oh, what the? Oh, big mallet, piece of wood. crushing somebody's skull. Could it actually happen with enough continuous blunt trauma and force? Yes.
Yes.
Quite impressive that we actually see the eyeball actually protruding out. Holy cow! You're getting blood coming down. Obviously, the person's still alive. Manage the individual, airway, breathing, circulation. You probably need to go on a ventilator. Obviously, there's going to be traumatic brain injury, but the ultimate question ends up being, will the person survive, and will they survive with a meaningful life?
I just don't know. It seems like you're trying to speak, but you just took a hell of a hit.
Might not be able to speak because the part of the brain that has been affected by the trauma could be the area of speech. There's an area called Broca's area, which has to do with speech, so it could be affected. We see this a lot when people have strokes, especially on that side in that area of the brain, and they can't express what they want to say.
I just popped your skull so hard, your eyeball just popped out.
We actually would try to cover up the eye itself just to protect it. You worry about retrobulbar hematoma. Basically, there's a pocket of blood behind the eye pushing the eyeball out. If that does happen, it's an eye emergency because it's pushing on the optic nerve in the wrong direction.
The wrong direction! No exceptions.
Oh! Oh my gosh. Oh! What? I wasn't expecting this. Everything is just smooched and squirted everywhere. When you actually have just brain matter, it's actually just grayish white. Injury that doesn't come to the emergency department. But we do see people where part of their skulls might be removed, fractured open, and brains are coming out. Oh, what the? Come on. Come on. Come on. Well, obviously, they took my advice a little bit too extreme for when I say don't pull it out. And we're just stepping on some skulls. The colors could be because of just rotting flesh at different ages. Our skin changes different colors because of that. If I took the top of a toilet to my head, that porcelain's gonna knock me out, could cause even a cervical fracture. Obviously wearing this big helmet, and again, it's a walker, it's a zombie. Their effects of pain probably are lacking. Oh, right through your hand. But if you see, spike went between the knuckles through the soft tissue. So unlikely that there's a fracture. If somebody comes in with an injury like this, we actually will get an x-ray just to make sure the bone was not hit. You do worry about nerve injuries because the nerves run along the sides. Do you close it up or not? So it's a puncture wound through and through. So you maybe want one side to be partially open so it can drain, just in case you do get it infected. You gotta make sure your tetanus shot is up to date. I don't think they have that for this. The skin is coming off, almost like rotted looking, abnormal colors. People will come in looking pale, white skinned because of lack of blood flow going through their body. Oh, geez. I mean, that zombie looks pretty ripped.
Pretty cut.
You can see the muscles, you can see the striations. There's no subcutaneous fat anymore. It's gone. The body breaks down and starts shutting down. It's gonna have an awful smell as well. You should be able to smell these walkers a mile away. Oh, whoa! Taking the butt end of a rifle to your face can fracture your jaw, break some teeth. Sometimes your tooth will go flying out of your mouth. Find it, rinse it off, but don't scrub it off. Maybe put it in milk, put it in Hank's balanced salt solution. If you don't have any of that, you can put it in your own mouth. And then get to the hospital ASAP.
Take me to the hospital.
Hey, maybe we can shoot our way past them. You guys still have guns. If you have the ammo.
You have the guns, I got the ammo, and we're separate from each other. I'm pretty useless. Oh! Dracula type biting going on. You're seeing blood kind of pooling out. In that area of the neck, if you're actually getting that much blood, you're probably hitting more of a major blood vessel like the internal jugular vein. Oh my gosh. Holy cow. I can't believe they show this on TV. Manually ripping somebody's cheek. Ouch. Typically, humans can't go through with it just because of restraint from actually doing that. On that side, there's a lot of muscles and then major blood vessels. And so you're ripping through the soft tissue and it's gonna cause a lot of bleeding. To think about the psychological trauma that occurs to this individual watching their friend getting their face ripped off. What could happen is it could actually freeze you up in the future in a certain situation where you need to act.
Angela, come on. Honey, you can do it. Sam, you're gonna do it. Sam, honey, I need you to come with me. I need you to come with me. I want to.
Maybe the kid just couldn't move, paralyzed due to fear, and your body just won't move because of it.
I need you to be strong.
Oh my gosh. We'll see individuals where you have different types of facial traumas and you'd expect that the facial trauma killed the individual. There are certain areas of the brain that if they are injured, there's no outward sign of injury to the individual. There could be some processing issues or some personality change that will only show over time. Whoa. Where did the bullet go?
Which way did he go, George?
Okay, so that individual is down and the zombies are taking over. Oh man. Whoa. I'm assuming the bullet went into his eye. We'll never be able to recover that. The eye trauma is done. There's no more globe. Now you just have a hole. But now the issue ends up being, where did the bullet go once it actually passed through the eye? Was it going at an angle that it went out the side, or did it go straight through to the back, going through brain tissue? In this situation, put pressure to the wound. Obviously, you can't get to the hospital at this point, so hopefully you're not having brain swelling due to the trauma, which can cause you to be altered. And then did it actually go into the balance center of the brain or into the brainstem? So balance center of the brain is your cerebellum. If it hits the brainstem, there's not a lot of survival because that's where all your autonomic nervous system type function is.
A herd's coming! Bug out now!
Ooh.
Oh, Jesus. We gotta get the hell out of here.
Oh, no. Oh, that is the worst.
That's the worst.
The arm is trapped underneath, pretty much like immovable object. Two choices. Somebody comes up with enough strength to get that log off you versus cutting off the arm.
Get the mules out here. You! Get over here right now!
Get it off there. The concern of that type of injury is a crush injury, so a fracture of the humerus, shoulder, maybe a dislocation, and then also the breakdown of the tissue itself. You worry about rhabdomyolysis.
Where's the dick?
He's gone. It's just me.
It's just you.
Okay.
Ow. Hard to see, but it looks like it is all the way down to the bone and there's no other tissue there.
I have to amputate.
Why she says you gotta amputate, it's like how you're gonna salvage that, where you're gonna get muscle, where you're gonna get tissue to cover over top of it. So in this situation, you just need to cut it off.
What? There ain't no other way?
The only way to stop the bleeding is to amputate and cauterize the wound. Here.
From the elbow down, and they're putting a tourniquet above it to try to reduce the blood flow, but you can't cauterize the big major blood vessels. Maybe in the arm they won't be as big, but they're still going to be maybe just the size of your pinky or maybe a little bit smaller. You actually have to tie those off.
You got something for the pain?
It wouldn't kick in fast enough. We have to do this now.
Maybe the medications that they have there are only, say, like oral medications. So if you take an oral medications, it can take 30 to 45 minutes for it to actually kick in. Versus if we have it in IV or IM medications, usually a minute or two.
Oh, sorry, man.
Oh my gosh, like a blowtorch. You can heat up metal and then kind of touch it to those areas to cauterize it with a hot metal versus actually like a flamethrower.
I need you to hold him down for me.
Besides the pain of the injury, even putting a tourniquet on really tight hurts like hell. See the importance of books when you don't have the internet? The knife, saws. The saw actually is probably a lot better because of the teeth on it versus a knife that's just a straight blade. Of amputations that I've seen, it's usually a saw, maybe a wire saw versus a rigid saw. Oh, jeez. Oh. Oh, what is this, like concrete rebar? This could be straight through your spleen. This could be straight through the lower part of your lung, or it could be in the intestines right where it turns right there. The left side. The likelihood that it hit your kidney, it's a little bit too lateral. Definitely could have broken some bones of the ribs. That's probably where they're lower. Probably most likely lower lung or spleen. You can live without your spleen, but you know, you can't live if you're bleeding out on the inside. You're stuck to this hard piece of concrete, rock. The only way to get out of the situation is to pull it out, so to speak. But the only way to do that is to lift yourself off that. So I don't think this individual's got a good chance. He's gonna try to pull himself up with the... Yep. Ah. Run, run.
Run, Forrest, run!
Wow, that is impressive. Now you're gonna deal with rust. Hopefully his tetanus shot's up to date. It's not necessarily the rust, it has to do with just the pathogen on these things. Well, at least the horse is hanging around. Woo. So you haven't bled out yet, you're just in a significant amount of pain, but pain prevents people from moving. If you can muster up the ability to tell your brain to keep moving, you can get out of this situation. Whoa! Wow, okay. Straight through the suboccipital. Suboccipital, so back of the skull, into the mouth. If you're going with that blade, it's gonna most likely sever the brainstem. Our basic autonomic nervous system. We're not going to be able to have a normal function of our breathing apparatus or heart. I feel like all these characters need something called Chillax. One of my supplements. Definitely check it out for yourself. Something that'll nicely help and aid in stress. Oh. What the hell? Oh my gosh, they're just heads, they're still alive, that's crazy. But they're infected. Will the infection pass on? You got open wounds. Dirty water is the pathogen that's causing this in there. Let me know in the comments for all of those Walking Dead buffs out there. Oh, get the glass, use it as a knife. You might cut your own hand, but potentially gonna save your life. Yep, there you go. Whoa, it's gonna hurt. Oh, right in the eyes. Not a lot of blood in the eyeball itself. It's mostly fluid, but there is blood to the back of the eye that's supplying the eyeball itself. So there could be some bleeding, but they always make it seem like there's a lot more blood going on. It's mostly fluid. Oh, and even smarter, snap it off. It depends on how far that piece of glass went in. Did it go just through the eye socket, not to the brain itself? Is it into the frontal lobe or into the temporal horn? So these two areas.
What the hell are you gonna do now, sport?
Stop it. They always say that biting through a bone or finger is like biting a carrot, but there's a human component that prevents you from doing that full bite. They're saying you're able to bite deep enough to hit the jugular vein, not super easily accessible. If you rip open the vessel itself, you're not going to go down that easy, that fast. You will bleed, but your first instinct is going to be to try to get it to stop. Just don't compress both sides because then you decrease flow out.
We get to come back.
Nope.
Liar.
Oh my gosh. It's a partial amputation or decapitation at this point, hitting the major blood vessels of the right side of the neck, including the carotid artery and the jugular vein. There's not much bleeding going on yet, and he's still aware because he's totally not decapitated and his spinal cord is intact. Oh, shot to the upper thigh. A lot of meat there. Hopefully it didn't hit any major blood vessels. Most of the time, by that point, the major blood vessels are trying to cruise behind the femur itself. Oh, see, he's still alive. Good job, whoever created this. Not totally bled out yet and is still trying to survive. Nope. Now I changed my tune. A lot of force. This blade needs to be pretty sharp. Maybe soft tissue, no problem if it's not the sharpest, but to cut through bone, it needs to be really sharp. But again, you can hack away for a while. Oh, so classic of Dexter. It almost looks like a 10 or a 15 blade that he's using. Basically a scalpel, but there's different shapes to them. That type of cut in general, it's super sharp, so it's really easy to close up. It will probably heal really close, like a paper cut, so to speak. Dexter here has his own kind of PPE. We use similar things. The face shield is quite similar. We have a mask with a shield. We don't use the aprons, but we use sterile gowns. Oh, a hammer. Pick up the hammer. We do get hammer injuries, traumas from people hitting their hands, but we've also, unfortunately, seen where people use hammers as objects to hurt each other. I've definitely seen some head injuries related to it. The back part of the hammer, a little bit more sharp, so to speak. If it's into the brain, depending on the frontal lobe versus deeper and multiple strikes, we'll see people come in with hematomas, contusions, or intracranial bleeding, a subarachnoid, a subdural, or just destroyed brain tissue. And if there's likely destroyed brain tissue, there's really not much for us to do.
Hello?
Dexter, I need you to go to an all-night pharmacy right away.
I'm kind of in the middle of something.
Sometimes I will answer the phone when I'm in the middle of a procedure at work. I don't know the number, but I need to answer it. All my work calls go through our cell phone as well. If they just don't have my cell phone number, they have a different work number that gets transmitted into my cell phone.
Oh, Harrison has an ear infection. He's in a lot of pain, Dexter.
Right, my mistake, I wasn't thinking. I'm on my way.
Harrison has ear infection, his son. Ear infections stink. They are very painful. It's swollen tissue that's supposed to move when you hear. It also has to do with a lot of inflammation just in and of itself, and it's very innervated there, so you feel it a ton.
The good of the family.
Oh, it looks like he's going closer to the left side of the heart. You're gonna leak a lot of blood out into the mediastinal cavity, and then eventually you're gonna bleed enough to where it's not pumping out blood to the rest of your body, or it's gonna compress down and not be efficient anymore.
Well, I'm real sorry for you, boss, but your dead wife can suck my.
Oh, that's not good. Oh, that's a bad device. Oh, I'd see people headbutt each other. I don't know if it's like the smartest thing in the world to do. Everybody says the bone in your forehead is super thick. Yes, it potentially is, but remember, you have your frontal sinuses here, which actually thin bone because it's got air in between it. Dexter getting splashed with the red stuff all over his face. In your face! Now you have body fluid exposure. We're worried mostly about bloodborne pathogens like HIV, hepatitis B and C.
No, I'm here to kill you with that pen.
Whoa. Hard to tell if it's an injury to his left shoulder or left chest, but more likely it's going to go into the soft tissue. Potentially, if it's more anterior chest wall, there's always a risk of trying to go into the lung. You'd have to have a lot more force to be able to get there. Oh, he's going directly into the major vessels of the left side of the neck. Carotid artery and your jugular vein, you have it on both sides. You have the sternocleidomastoid that sits over top, and underneath that is where those big vessels run. Yeah. So actually they're doing a pretty good depiction of it. Very dark blood, so this is probably venous blood. This is most likely the jugular vein just bleeding out. What he's experiencing, potentially getting lightheaded, dizzy, but would you pass out and would you succumb to the injury super fast? Probably not. You have 10 to 12 pints of blood. For you to potentially pass out, you need to probably lose about 25 to 30% of your blood volume.
Friends forgive, but I don't forgive you.
Oh.
I don't get to have friends.
Oh, usually he uses a blade. Interesting. Strangulation type injury, which we do see often in the emergency department and do have to rule out any major injuries. You can see petechiae or bruising to the neck, and we will do a CTA of the neck.
You think I'm done with you? You think this ends here? It doesn't!
When we want to look at the airway and make sure that there's no damage, make sure there's no fracture of any cartilage, and we're making sure the hyoid bone looks fine, looking to make sure the spinal cord looks fine, and the bones around the cervical spine. We're also looking at the major blood vessels, hence the A part of the CTA.
It does for you.
Wow. Getting both their major vessels compressed down as well as the airway being compressed down. So those are two ways that somebody can potentially pass out. So you're not getting blood flow going into the brain via the arteries or blood flow out, and the decrease of oxygenated blood in will cause you to pass out. Oh. Did he snap his neck? You can have a high cervical fracture from twisting really hard on somebody's C-spine, but it's got to be high so it's closer to your brainstem. So it stops all that information going to innervate your body to breathe and have your heartbeat. So the diaphragm's going to stop. Your autonomic nervous system is going to be interfered with. Oh, Miami Airport. Oh my gosh, how often do you get mad when you see a closed bathroom and you need to go? The closer you get to the bathroom, the more you feel like you gotta go, and that has to do with your body's like nerve impulses that you're about to cause a relaxation of your sphincters so that way you can decompress your bladder and let things out.
Excuse me, sir, I have your wheelchair.
I don't need a wheelchair.
Oh, the classic Dexter injection of medication. If you're looking for a legal, non-prescription way to knock out at nighttime, you should try Do Not Disturb by my company Life Happens to help you drift off to sleep naturally, no needles, and no neck trauma required. Find it at lifehappens.com or on Amazon. We don't like when people are in that position where their heads are down like this because they can occlude their own airway. That's why when you do like CPR and you're doing rescue breaths, you either do a head tilt chin lift technique or you do a jaw thrust because you want the airway to be open, or the jaw thrust when you actually grab the angle of the mandible and pull forward. I've had many cases over the years where people have difficulty breathing and you put them on a BiPAP machine, which is that mask like a CPAP. They're so weak and tired that they start occluding their airway and they're going to start retaining CO2, becoming more altered, so you actually need to intubate them.
It never matters your destination. The smart traveler must be prepared to make last-minute adjustments.
The wheelchair did not have the wheels locked. You want to be really careful when you're transporting people and trying to put them in a wheelchair because it can go out from under them and they land and hit their buttocks, hit their tailbone, or go all the way backward and crack their skull open.
You do blood spatter. So? So? There's no blood here.
What was that?
Yeah. There's no blood in or on or near the body at all. It's the weirdest thing you ever saw.
We have like 10 to 12 pints of blood in our body. Getting the blood out of the body, you have the issue of the blood trying to clot. We draw somebody's blood, we always have to worry about it clotting, or when the blood gets out of the body, it clots pretty fast.
No sticky, hot, messy, awful blood. No blood at all.
What?
What a beautiful idea.
Anatomy, tissue cuts, actually pretty impressive. Thighs and the legs, you're seeing the bone. You know, you see the femur on the right leg. On the left leg, since it's below the knee, you should see the tibia and the fibula. Hard to tell.
How does he do it? How does the killer get rid of the blood?
It's hard to say. The body's in good shape.
Trying to show us the different muscle tissue as well. Given it a couple different colors, it's probably all going to be in one color, but again, it was probably found in a pool, so then you have the issue of the water getting into the tissue.
Never seen such clean, dry, neat-looking dead flesh.
Yeah.
Wonderful. Very clean.
You see how the wounds are perfectly cut. When I talk about replantation, when somebody gets an amputation, these are the kind of wounds that have a better chance of being replanted or reattached to our bodies because they're just perfect cuts.
Cut the leg in 4 pieces, almost like using a ruler. But this leg is in 3 pieces. And look, he started to make a 4th cut, but stopped. It's possible that he got interrupted.
You're cutting through not just the tissue, but also the bone, and the bone itself has blood inside of it. We actually use IVs that can go into bone, it's something called an interosseous line, when we can't get an IV in an emergency.
Last thing I need is a complicated crime scene.
Whoa, darn.
Someone cut him open and sewed him back up.
And it just got complicated. His incisions were made post-mortem.
They're able to tell all this post-mortem, pre-mortem. We're not able to tell that with a regular medical education. You have to be specifically trained how to identify these things.
His stitchings are really weird. There's like an A and then a horseshoe kind of thing.
And even the sutures are weird. You can tell the wounds are relatively new just because of how the tissue has come together. It's still open. They're not like nice sealed wounds. But the sutures that they use aren't really sutures. This is like string.
It's string.
If you're using this type of material, it's gonna likely cause infection. What? Something's inside the body!
There's something inside.
Ah, so they wanted somebody to find it, cut them open, and get whatever's in. Snakes, maybe? You're seeing Dexter take scissors to cut the sutures. When we remove sutures, you want to cut on one end of the knot. You don't want to cut both ends, because then you're going to have the piece of suture material still in your body. Yep.
Holy franken snakes!
How many of you out there like snakes? Let me know in the comments.
I hate snakes!
I do not like snakes, but I don't know if you guys knew, my wife Jen had a pet snake many, many years ago. Thank goodness, before we met. Oh, geez.
I'm gonna put you out of your misery.
Oh, taking a blade right through the top of your foot. That's like the distal end of your metatarsals, maybe right in the middle of the foot. With that wide of a blade, you're definitely causing a fracture to the bones, one or two of them. Blood vessel abnormalities, you're gonna cut through, and the nerves. The nerves are going to be damaged for a long time. Foot is stuck to the floor. You have to take it out. But in general, very large objects that are still in your body, you run the risk when you remove them that they're gonna cause a massive vascular dump where all the blood's just gonna start pouring out of you. If you're gonna go directly to the hospital, sometimes it's fine. Direct pressure to the area, wound dressing, elevate it will all help. So the classic chokehold, how somebody getting knocked out from that, that's a quick decreased blood flow to the brain. You could be cutting off somebody's airway, but it shouldn't make you pass out in that short of a period of time. Typically it's due to blood flow. You can also have somebody die if you decrease too much blood flow to the brain for too long of a period of time.
You used to just cower and cry.
Oh. Stabbing into the heart. The heart now has a hole in it. If you were to take the blade out, the heart's going to continue to pump into the body, but it's also going to lose blood as blood is going around the heart, compressed down on the heart. You're going to see something called pericardial tamponade.
That's not just for me. That's for everyone that you hurt. Even Emily. Do you hear me? Do you hear me?
Would you die from blood loss? Probably not. You're gonna lose maybe a pint or two around the heart. At the aorta, you have the coronary blood vessels. If you're not squeezing blood out, you're not getting oxygenated tissue to the heart muscle, decreasing the squeeze and the mitochondria and the energy, so then the heart's gonna stop as well.
You got quite the God complex. This session's over.
Oh, gonna make him pass out again. Dexter is usually all about that instant lights out shot to the neck. If you're looking for a legal, non-prescription way to knock out at night, you should try Do Not Disturb by my company Life Happens to help you drift off to sleep naturally. Find it at lifehappens.com or on Amazon. The plastic curtains and the garbage bags. Oh, the classic facial laceration to get a little bit of blood on the face. There's a ton of blood vessels. Small little cuts will bleed like stink. If you put compression to the area, hold it for a little while, it'll actually stop and actually might even reseal itself. It's almost like a paper cut. Oh. What are they doing? Electric blade. It almost looks like a sawzall that you'd use in construction or cutting wood. The blood will drip like that and eventually form some clots, but because it's still flowing, it's not going to clot right away. No, whoa, we're missing some skin here. Oh my gosh. Seeing the subcutaneous tissue. Ouch. Ouch. Usually when the skin is removed or cut, it spasms up and actually becomes a lot smaller because it's really taut on our bodies.
When I return, there'll be no rest. Use the time to think about the skin you have left to lose.
Oh my gosh. It's gotta be extremely painful because we're using a regular knife, not a sawing technique. The blades that we use at the hospital, scalpels, they call them X-Acto knives, should be very, very sharp, but every time you use it, it actually gets a little bit more dull. That's why at the hospital, we actually dispose them when we're done. We don't reuse them.